My name is Paul LaDuke. I am a Doctor of Athletic Training student at A.T. Still University. Welcome to my Advanced Research Project presentation. My project was on improving the emergency planning in the school district where I work. This school district is in Boulder, Colorado. The background that you see is a picture I took from the parking lot of the school where I work. I'd like to thank my advisors, Dr. Tamara McLeod and Dr. Haley Root, for their tireless efforts in my project. In 2017, Adams and et al. Graded and ranked high school state athletic associations' health and safety policies in 5 key areas. These key areas included sudden cardiac death, which included required education of coaches in CPR and AEDs, as well as access to AEDs. Concussion management, which included return to play protocols and requirements of doctors to clear and manage the concussion. Heat acclimatization, including access to cold immersion. Appropriate medical care, which involved licensing athletic trainers and access to athletic trainers. And emergency preparedness, which mostly involved the emergency action plans and their requirement. This was of special interest to us in Colorado as the study ranked us dead last of the 51 associations studied. It's no wonder that CHAS's policies do not address best practice recommendations. The aim of this project is to increase the percentage of venue-specific EAPs to 90%. This would mean 59 of the 65 athletic venues within the school district would have an EAP. Additionally, I want to improve the quality of the venue-specific EAPs to contain greater than 90% of the information that's required from the checklist. I chose 90% because of 5 of the pieces of information are day-specific, such as size of the crowd, date, time, weather, etc. So those don't really need to be included in the written EAP, but can be part of the daily EAP as we think through those things. Additionally, I want all these changes to occur within the next 6 months. To the heart of this presentation. Emergency planning saves lives by providing an efficient and structured response to sudden cardiac arrest. We all know that SCA is the most common cause of death among high school athletes. Emergency planning to catastrophic injury can reduce the severity of that injury and even prevent death in cases of paralysis, catastrophic cervical spine injury, etc. Emergency planning should also cover lightning and where to go, how to monitor, who's going to monitor, who has the call to when to suspend practice and games, etc. Emergency planning also involves proper responses to heat illness. Heat illness is the second most common cause of death among high school athletes and is 100% preventable. Additionally, the proper response to heat illness can save lives by proper and quick recognition. And lastly, emergency planning must involve any emergency event where EMS is called. This helps with the structured flow of who's going to meet the ambulance, where they're going to meet, all those things. Emergency action plans are the best way to provide the emergency planning process to your coaches, to the athletic department. It also provides a written piece of education that can be used to help with the education of the coaches and the first responders. So these emergency action plans must include effective communication between EMS, between coaches, between the athletic trainer, who's going to make the calls, etc. That must be written down. Secondly, the EAP should include plans to train initial responders in CPR and AED. These aren't just the EMS, these are your coaches, assistant coaches, maybe even student athletic trainers, a school nurse, etc. How are we going to train all those people that are right on site already in CPR and in the AED? Thirdly, the EAP should include the purchase of and access to emergency equipment. Most importantly, the AED. AEDs saves lives, but where are they located? How can they be accessed? And is an AED within 2 to 3 minutes of every single athletic venue? If not, how can we get that to happen? Fourthly, the coordination with the local EMS system. It's imperative that they know where to go, are familiar with your campus and different access points. And lastly, the practice and review of the EAP. This is critical in the emergency action plan to know what to do and to review that at least annually. In review, a prudent EAP requires training personnel, quick access to life-saving equipment such as the AED, and practicing the plan. The literature is very clear on these things, that having properly trained personnel can save lives. But that's not just enough. You need to have access to the life-saving equipment, particularly AEDs, and then they also must practice the plan at least annually. In the aforementioned 2017 study by Adams et al., the emergency preparedness section of the study was the lowest scoring across the board. They studied 5 subsections within emergency preparedness, which included EAPs, which my study focuses on, but also includes coaches' education in sudden cardiac death. Surprisingly, less than half of the state associations have a requirement for coaches to have an education in sudden cardiac death. Coaches training in CPR, again, surprisingly, many states do not mandate that the coaches be currently certified in CPR. Pre-participation physical exam questions, including exertional sickling questions. These questions have become very standard on PPEs, but many states do not require a standard PPE form. This could save lives by alerting coaches and athletic trainers that this athlete is at risk for exertional sickling. Just like heat illness, most exertional sickling issues can be prevented if the athlete is known to be at risk for exertional sickling. And lastly, supervision of strength and conditioning sessions. At the high school level, many programs go year-round, especially in strength and conditioning sessions, but there is no requirement for supervision, let alone coaches that are trained in CPR or SCD, etc. This is a huge liability for school districts, but again, state high school athletic associations have not mandated proper supervision of strength and conditioning sessions. CHASA has since required venue-specific EAPs. That initial study came out in 2017. I think part of their requirement for the EAPs was in response to this study that Adams et al. Performed. So they, just earlier this school year, August of 2018, changed their bylaws to require all athletic departments have venue-specific EAPs for every single venue that they have a sanctioned sport in. In order to analyze their EAPs, throughout the whole process, we developed a comprehensive flow chart. First step in improving the district EAPs was to survey all district ATs and have them in the survey list all the athletic venues that they have for CHSAA sanctioned sports. At the end of that survey that we distributed through the email, they were able to upload their EAP documents. We had all the EAPs, and we also had a list of all the venues. So we needed to check to see if all district venues had an EAP. If they did, we evaluate the EAP with the checklist, the previously mentioned 48 piece of information checklist that was developed by CHSAA and also included information from the Adams et al. Study in 2017. If the venues did not have an EAP, we then asked and will ask the athletic trainers at that school to develop a venue-specific EAP. Once that is developed, then that can be evaluated via the checklist. Then we want to see if the EAP is missing a checklist item. So for each individual EAP for a venue, we analyzed it via the 48 item checklist. So is it missing an item? If yes, the information needs to be added and the EAP must be updated. So we update that and then we check it again. Is the EAP missing a checklist item? Once we can say no, then we know the EAP meets the best practice standards as currently known for emergency action plan. So at the end of the process, the goal is that all district venues have a venue-specific EAP meeting best practice standards. The Quality Improvement Project, there is a need for a PDSA cycle for which to design the study off of. PDSA stands for Plan, Do, Study, Act. So the plan portion of this was to collect the EAPs and then list all the venues that are used within the school district for CHSAA sanctioned athletic events. To do, we needed then to check the venues, make sure they each had a venue specific EAP for the venue. And then we wanted to analyze each single EAP against the 48 item checklist. Then we needed to study, list general deficiencies within the overall EAP documents, and also list individual deficiencies within each of the EAPs. Then the action plan after that is to write missing EAPs, since many of the venues will probably be missing an emergency action plan, and then to improve each of the individual EAP information. So now onto the results. The results are broken down into basically 3 different sections. First one, does each venue have a venue-specific EAP? The second was the results of the general EAP analysis. And the last is the individual EAP analysis, which is the bulk of my results. This included facilities information, contact information, and roles and responsibilities of the people involved in the emergency action. Does each venue have an EAP? So here you can see the table with the 6 schools listed. Notice that school number 2, school number 5, and school number 6 did not have any EAPs that they uploaded. They did complete how many venues they had, so we do know how many venues are being used by the school district. And you see that at the bottom is 64, but only 25 of those schools or venues have an EAP, which is roughly 39%. Of the schools that did hand them in, schools 1, 3, and 4, you see a pretty good coverage rate there. 7 of 10, 7 of 8, and 11 of 14 venues with a venue-specific EAP. So overall, 25 of the 64 EAPs venues did have an EAP. Next is the general EAP analysis results. There's a lot of information here, but if you notice the center column there, most of the EAPs did not have this information included into the general EAP. If you look at each individual line item, you notice this is more the table of contents, how the EAP is distributed among the athletic staff, rehearsal information, and a plan log. There's only just a handful of EAPs that have this information. This can be easily included into the documents that we have, but at this point we do not have those in our EAPs, but it certainly would make it much easier to use. The facilities information analysis had some mixed results. The venue specific information, you can see all of them had the name, address, and phone number. That's pretty standard. But many did not have the nearest hospital name or address, which is important information to have. The internal external site map, in fact only one of the EAPs even had a physical map showing the school from like an aerial view. These are important to have just to help people visualize where they need to go, where they can meet for access points, etc. None of them included where the athletic training room was in the facility. I think that's because most people assume the coaches know where the athletic training facility is. So that's just kind of an oversight, but that can be easily remedied with the existing site maps once they're added to the EAP. Next, you see the equipment and supplies. All of the EAPs that were gathered identified where those supplies were and who would have them. And then the last section, that was the section I mentioned before, that's event-specific information. I don't really believe this needs to be in our EAP document. It was suggested by the CHASA template that we downloaded to be included in the EAP, and is certainly good information to go over in the medical minute beforehand. So it can be included in that, but I don't think it's necessary to write it down, because then you'd be writing an EAP for every single home event. And at my school, we hosted over 300 events this year, so that's not quite feasible to put the date, the time, etc. But that is something we can discuss between coaches and emergency personnel that are on hand for games. Next, we analyze the contact information, and here are the results of that. As you can see, most of this information was included in all the EAPs gathered. Third-party security was not mentioned in many of the EAPs. I believe that was only mentioned in one of the EAPs. That's why it's 11 of 25. The fire and police, that's 911 in our area, so that can be easily remedied by adding fire and police and ambulance all together into calling 911. So overall, this was some of the best information, the contact information contained within our EAPs at our school district. The roles and responsibilities analysis gave us quite a bit of information, and as you can see, almost 100% of the EAPs had this analysis, or had these roles and responsibilities listed in them. The only thing that was not listed was who is responsible for retrieving supplies. Again, I believe most athletic trainers just assume that they're the one that's responsible for retrieving the supplies, and the coaches, I believe, assume that it's the athletic trainer that will be retrieving the supplies. So that's just has been an oversight into writing that into the EAP. The conclusions of this quality improvement project were that 50% of the district's high schools did not have EAPs. Yes, only 3 of the 6 were able to upload EAPs. Only 39% of the athletic venues had an EAP written for it, 29 of the 64. And lastly, 78% of the existing EAPs lacked dispersal, rehearsal, and plan log information. So much of the necessary information in an EAP that will help decrease a school district's liability is not even existing in the EAP. So many things that we can change to improve our emergency action plans at the school district. So the recommendations from this quality improvement study of my school district is to develop an EAP template, a venue-specific one for each school, including the address and the maps and the closest hospital, etc. These can be used to complete the EAPs for the venues that do not have an EAP. I know in writing my own EAPs, once I had that template down and could copy and paste things, it made it very easy to develop a venue-specific EAP and adapt a few lines here and there to make it specific to that venue. Secondly, I'd like to perform a second PDSA cycle to measure the improvement. This first one just kind of gave us a baseline of where we're at and many of the improvements that we can make within our EAPs. I'd like to perform a second one just to see the improvement. And lastly, recommended to develop and implement an EAP distribution and rehearsal plan with each of the school's ADs and all coaches. The goal of an EAP is not just to have the paperwork on hand, but it's actually to save lives. Emergency planning saves lives. It's as simple as that. So being able to distribute the written document so that the coaches can refer to it as a refresher and then rehearse that at least annually would be a huge help when an emergency does arise, and we can hopefully save a life. As with any study, there's lessons and limitations to be learned. First of all, we had a couple of issues in the process of gathering the data. These were unanticipated just due to the development of the survey. First off, a couple of the athletic trainers were given an error message if the survey was not completed in one sitting. So they'd get a reminder, they'd go back to the survey and it would tell them they already completed it when they had not. So we had to go back in and correct that and actually send them an anonymous survey so that they could take it a second time. Secondly, 3 of the schools did not have any EAP documents. I was not expecting that result. That really made a big difference in the numbers, as half the schools didn't have documents. Also, limitations of the study. This is just one school district out of the 177 CHSA member school districts. Represents 6 of the schools within CHSA's 360 schools that they have. One of the things we could have done to make things better would probably to have a pre-survey CEU conference on EAPs. That might have improved the length of time to collect the surveys. The 3 schools that did not have EAPs may have taken the time to written some EAPs for their school. And so I think having a conference beforehand would have helped that. We meet monthly as athletic trainers and it would have been easy to go over that beforehand. But I will be performing a conference in a few months covering the results of the EAPs, and that will give us the opportunity to talk to the athletic trainers that do not have EAPs on hand, give them the tools to develop them very easily, so that we can finish off the quality improvement project and meet the goals as stated earlier. Thank you for watching my presentation for my advanced research project. It was a great process for me and helped me learn quite a bit more about the quality improvement process.